Hello, my name's Maureen Kelly and I'm the chair of Healthwatch Sefton. That's an independent organisation that exists to ensure that the public of Sefton can have their voices heard around health and social care, and that those voices are heard. The purpose of this video is to celebrate 70 years of the NHS, and over those years there have been various platforms by which the public can have their voices heard. First, we're going to hear from Liz Dowd and Councillor Paul Cummins about community health councils. Then we're going to hear from Janine Clayton about PPI, that's Public and Patient Involvement Networks. And then lastly from Ken Lowe about Sefton Involvement Networks and his current work with Healthwatch Sefton.
So, my name is Liz Dowd, and between 1996 and 2002, I was Chief Officer at South Sefton Community Health Council. Community Health Councils were set up in 1977 to represent the interests and voice of patients, and it was patients, and latterly the public, a slightly broader role in the NHS. They covered all aspects of NHS care, GPs, hospital care, care in the community, everything. And they were made up from a council. They were community health councils. And one of their great strengths was that the people who sat on a community health council all came from the local area. They were small, but in my opinion, perfectly formed organisations because they had local representative in terms of the council, and but they had a statutory function, which meant they had powers and they could hold the local NHS to account. And they would do that through a range of different ways. They could formally challenge, but it really was about getting to know and understand what your local NHS was. And one of the ways we did that was that CHCs ran a full advice and information service and a complaints and advice service. So we got to hear about directly from the patients who were perhaps experiencing problems what the local issues were. And we used this vital and local intelligence to essentially form our work plan and the things that we would prioritise on a kind of annual rolling basis.
Councillor Paul Cummins, I'm Sefton Council Cabinet Member for Adult Social Care currently, and have been for the past 6 years. Back in the 1990s, in the olden days, I became chair of the old Social Services Committee, and associated with that I was nominated by Sefton Council to be a member of the South Sefton Community Health Council, and I ended up doing 2 full terms. I remember we covered an awful lot of issues on the Community Health Council. I was particularly interested in mental health. That was my background, working in mental health services. And I remember in the early days particularly there was quite a focus on that. But then all sorts of issues to do with very local health services at GP level through to the hospital services.
In particular, I think you have to remember that in 1996, things like waiting times for orthopaedic operations, hip replacements, knee replacements, were not as they are now. We were part, I think, of a lobby that really pushed that government then and subsequent governments to introduce the kind of fantastic targets that we have in the NHS. So today, you can expect to wait 18 weeks from the time you are referred from your GP to the time when you have an operation, say perhaps for a hip or knee replacement. When I came to the CHC, it could be as much as 4 years. So one of the first things we did as a council was join that campaign, that national campaign of other CHCs and patient and public groups all over England to campaign for improvements. And I think together we achieve that.
Jenny Clayton. I've lived in the West Lancs area since I was born. I was born the same year that the National Health Service was instituted. Well, in 2003, which is the year they were set up, my husband happened to have had a brief stay in hospital in Southport and had had a very good experience. And I mentioned it to a friend of mine who happened to be the organiser of the new PPIs, and she said, "Will you join us?" So I did. It wasn't an easy process. We had to be interviewed over the phone, and we had to have referees, and we had to attend quite a few trainee courses too. We could raise issues ourselves. We were trained to enter and view our trust, which was the hospital, Southport Non-Skirk Hospital. We dealt with diversity and equality, even back then when it wasn't such a buzzword. We met monthly, and we also met with the CEO of the trust monthly, where we could raise anything from cleaning of the wards to visiting the children's wards to discussing staff, appointments, Meditext. There was an awful lot we did do, and I got out of it. Felt as though I was pretty well informed, and consequently, a lot of people used to come and natter to the people who were on PPI just to get a gist of what was going on in the local area health-wise. So the retired people, or people who chose not to work, did get more involved with the face-to-face with the public. But when I could, I did, and we did flu clinics. We had an AGM where the public was invited and we chose a topic to talk about. When we were visiting the wards, we spoke to patients. We did cleanliness checks, and people always stopped us and asked, "Are you looking for the cleanliness of the hospital?" We attended outpatients clinics and sat with patients while they waited and asked what we needed to ask.
My name's Ken Lowe. I'm currently Healthwatch locality rep for Birkdale and Ainsdale, sometimes called South Southport. I'm on the steering group and we get involved in quite a few things with Healthwatch. I think we have to go back to the fact that it was the PPI forum that it was existing at the time, and its main emphasis was about hygiene. They would do unannounced or announced visits into wards and outpatient areas and hospitals and stuff like that, just doing hygiene checks. The mandate for Link became broader, and it was developing. We needed to develop a process called enter and view. Again, it could be announced or unannounced, but we also had to cover care homes and, in theory, GP practices, wards of any kind. The mandate was broad, except to say, unless it was an area where it was private. So if you went into a care home, you couldn't go into the rooms. So we had to develop a lot of the concepts around about what we were trying to achieve. And I think the enter and view process was the biggest one that was different, because you had to have a slightly different approach if it was a care home versus the PPI forum, which was all just about hygiene. We were looking at other safety factors, nutritional value. Was there a mixed menu? Was there good stuff to eat? Was it a variety? Did they have vegetables? Did they take the patients? Did they take the carer out? Yeah. How did the family feel about being involved? Were the family involved? So it was a whole different ballgame. And even the hospital visits were different as well, because we were actually talking to the patients. We were saying to the patients, how you get on in this ward? Are there things about this ward that you're not happy about? Are you happy about your treatment? Do you understand your treatment? So it was a lot more than just about doing the hygiene factors. Healthwatch is virtually the same thing. It isn't really all that different. It's got a stronger mandate, it's got stronger policy, it's got the support through Healthwatch England, but it's virtually the same thing.
I have a lot of links with the current Healthwatch organisation. organisation. In fact, I see it as very much the spirit of the old Community Health Council coming back in modern form. Of course, the chair of Healthwatch, Maureen Kelly, sits on the Health and Wellbeing Board, in which I have a place. And again, of course, Healthwatch has a place within social care as well as within the health service.
Well, I was the last of a large family. In fact, I was the 12th born. And I was born in 1947, and the health service introduced in 48. And my mother said I was a miserable little sod because I was the only child that she ever got anything for nothing, because they gave out powdered milk and I think some sort of horrible orange juice mixer which was concentrated, and I wouldn't take any of it. So she said that was the health service for her. Yeah, I think it's seen a lot of changes. It's a difficult thing to deal with. It's gone through many reorganisations. It'll probably go through more. Just as it's going to work, they'll reorganise it, as we've seen even locally, where they get rid of regional health authorities, and then we've now got CCGs, and there's no simple answer to solving it. I think the biggest problem we have over the last 5, maybe even 10 years is we've tried to turn the NHS into a business. We've set up foundation trusts to try and be competitive. Each trust has now got to say what they've got to offer at what price, and it's really reintroducing postcode lottery to some of the health service, and I think it's a mistake, and somehow or other we need to just drift back to the regional health authority looking at what's needed regionally.
I was born in 1948, so we're as old as each other, and the national health obviously has been vital to mine, my husband's and my children's health. All my children were born under national health care. We haven't had too much need to use the national health, but I'm sure I will do as my 70s advance. It's vitally important. I've lived in countries where there isn't a national health and you have to be insured or pitch up the money before they treat you, which really excluded a lot of people from getting continuous, regular health care. So it's absolutely vital and such a precious thing that our country has.
Well, politically, the NHS, from my party's point of view, is its biggest achievement, I think, and I am genuinely passionate about it. I'm not old enough to remember what went before, but obviously my parents were, and I'm a product of the NHS, and I've worked closely with the NHS over many years and had various roles as non-executive director of 2 organisations, as a governor of a hospital, and actually working within what used to be Fazakerley Hospital, now Aintree University Hospital. So I'm absolutely passionate about everything that the health service does and has done over that time, and want to see it remain and prosper for many years to come.
First and foremost, I am hugely proud to work for the NHS, and I don't know anybody who isn't, who works for it. It is the most wonderful institution. Having been established in 1948, it has looked after the people of this nation for nearly 70 years. And it is something that we should hold dear and be so proud of. But of course, it's changed massively. And what an ambitious institution it is. And there is nothing wrong with that ambition. Every year we treat more people. Every year we introduce new therapies, new treatments, new ways of curing people and keeping people well. I think the challenges for the NHS are what you would expect, ever increasing demand. The great thing is we all live longer, but it probably means that we then are going to be using for longer the NHS services to help us enjoy that longer life. I think the other big challenge is for us all to take some responsibility and do all we can to keep ourselves healthy.